Because so the right ventricle pumps blood into the pulmonary trunk, the left ventricle pumps blood into the aorta via the aortic ventilator valve.
Okay, that makes sense.
What side is that? The left?
This is
Right.
right.
Right, okay.
The right.
So it's less muscular.
Mm-hmm. Smaller, less muscular. Foraday tendinae. Tendinae. So these valves. Okay, that makes sense now. Shirt pocket. Here.
The trabeculae cornea? Trabeculae cornea? Cornea?
Trabeculae carneae.
Carnea. Chordae tendinae, and it's connected to a thicker, almost like a... The muscles? The papillary muscles.
So in a general sense, this is the interatrial septum right here.
Okay.
And then that's more specifically the fossa ovalis, which is a remnant of the foramen ovale
It goes between the two atria.
Right, in the fetal circulation.
Well, like ears. Yeah. Or both.
This thing? Oh, it's this whole thing. See, I couldn't see any of this.
So somewhere in that lungs there should be a big opening for the superior vena cava.
Is that?
That's the pulmonary trunk.
Okay.
That's the aorta. And then the ligamentum arteriosum is a essentially fibrous connective tissue that runs between the pulmonary trunk and the aorta. And it's a remnant of a blood vessel in the fetus that bypasses the fetal lungs. It's a shunt that shunts blood from the pulmonary trunk directly into the aorta.
I know what the coronary sulcus was the one that we were...
Yeah, the coronary sulcus essentially, let's put this back on here a little bit. It's basically between the atria and the ventricles.
Okay.
And that's where the large coronary arteries run. Is in the coronary sulcus right there.
And this would be the anterior...
interventricular sulcus.
Okay, and then the posterior...
Posterior interventricular sulcus would be that.
Right there, okay.
That's the inferior vena cava, that's the superior vena cava. These are the pulmonary veins, right and left pulmonary veins, right and left pulmonary arteries. That's pretty much it. Muscles. This is actually the best kind of schematic of the papillary muscles would be these little knobs.
See, it listed it as that one too, but we assumed they were the same.
Yeah, that's
right?
well, they probably used to have tendinous cords attached to that.
I see. Okay.
Notice how the tendinous cords are attached to these two ones. So these would be examples of papillary muscles right here. And then this is all the trabeculae carneae.
Is the pectinate muscles, is it just in the right?
Yeah,
Assuming that's what that
yeah.
It's not in the left atrium?
No.
Just in the right?
Just in the right atrium. And also in the... Well, it's the pectinate muscle in the right atrium, and actually both inner surface of the auricles. So, this actually yeah. So here you can see that it's smooth as silk here, and there's no.
Aortic arch, dorsiflavian, brachiocephalic, superior vena cava, azygos, you can't see. Your carotid is with the head, and your axilla is your armpit.
The aorta, the brachiocephalic artery gives rise to three arteries. It gives rise to the two common carotids. This is the left common carotid. Notice that it's closely followed by nervous tissue. But basically, this artery here is called the brachiocephalic artery. And that's the major big artery that comes off the this is called a azygos vein right here. And the azygos is a major drainer of the thoracic cavity. So you have the somewhat smaller left subclavian, and then it's actually one of the bigger arteries in the calf is the brachiocephalic artery, and the thoracic aorta is a big. The thoracic aorta is big. Look how big that is. So vein here is called the internal thoracic vein. Off of the brachiocephalic here are the two carotids and the right subclavian. So now what I'm going to do is try to find the right subclavian. That is the right subclavian. That's what I'm looking for. In all its glory. That's the right subclavian. And so the right subclavian and the two common carotids come off of the brachiocephalic artery here. And then on the it's a fundamental asymmetry in the way it's organized. If you look at the veins, for example, they're nice and bilaterally symmetrical. I mean, it couldn't be more symmetrical. Arteries, it's a different story. You've got this fundamental asymmetry here of blood vessels, so the big arteries coming out of the heart. You've got this big brachiocephalic, and right next to it, this littler left subclavian. And then the brachiocephalic gives rise to the two common carotids. And where'd it go? And
The right subclavian.
the right subclavian. And then of course the right subclavian gives rise to the axillary. This is very nice. The subscapular hardly ever looks that good.
Good job.
Hardly ever looks like that. And so you have vertebral arteries and veins that travel up into the brain via that route. So they're basically they're actually going up toward the spinal cord, and then they go into the brain eventually. Genital, basically in the male, the genital veins travel down in the spermatic cord down to the scrotum, and they come out. They come out of the spermatic cord, and they typically go into the large, either the abdominal aorta or the inferior vena cava. But I don't see anything that really. I don't see anything quite like that. That's really a lumbar vein and artery right there. So I'm not seeing any genital. That's probably the ureter right there.
Yeah.
It goes down to
This is the vertebral artery
This one, you have a
on